Hello, this is Lawrence Holve, and I'm giving a very quick talk on sciatica. Firstly, what is sciatica? Well, sciatica is any pain that runs down the leg, usually goes through the buttock, down the leg, and into the foot, often accompanied by numbness or tingling, or it can be just a shooting pain. If you have pain going down the front of your leg, it's not sciatica. So it's very easy to differentiate because the sciatica nerve runs down the back of the leg. So, what causes sciatica? Well, sciatica is basically caused by three different entities: compression of the sciatic nerve, inflammatory changes around the sciatic nerve, or what you can call myofascial referral pattern, which is a bit of a mouthful, but it's basically muscles around in the buttock area that can cause referral patterns going into the leg that cause sciatica type symptoms. Notice I'm not saying sciatica because sciatica really is compression of the nerve, but it does go into that group of sciatica like symptoms. So I'm including that. So what basically happens is that very often it's a disc problem. So the disc basically herniates, prolapses, or in the old-fashioned termage, slips, but it doesn't really slip. It bulges around the nerve and causes compression on there, and indeed can cause inflammatory changes, causing the chemicals of inflammation irritate the nerve, and that's why you get this pain running down your leg. And it's very upset by different positions you can take. For example, lifting your leg up can cause symptoms. You're getting out of a chair, and just twisting around is enough to put irritation on the nerve, causing those symptoms. If you want to find an exact cause, then you need an MRI scan, because an MRI scan, what it does, it shows discs, it shows bones, it shows disc heights, and if there's any prolapse, you can see it quite clearly, and you can see the disc between the vertebrae actually compressing on the nerve. And that is the number one diagnostic technique to find out what might be causing the irritation of the nerve. When a person comes, there are much easier tests, because you don't very rarely do I need to send a person for a scan, because there are a few tests you can do by just lifting the leg up. Because if you lift your leg up and it pulls all the way down your leg, you're putting a traction on the sciatic nerve, meaning the sciatic nerve is displeased, it's angry, and that's enough to cause, and that is diagnostic of sciatica. So, treatments for sciatica. I'll start with what I do to it. So let's start with osteopathic treatment. Osteopathy is used widely to treat sciatica, and what it does, it restores joint function. In a nutshell, reduces muscle spasm manually by releasing joints, and often can be very effective in helping sciatica turn around. So when a person comes, you can offer osteopathic treatment, restore the joint mobility if it's stuck, and just moving joints about, increase blood flow around the area, and reduces the amount of inflammatory markers around the nerve and reduces irritation. The other method I use, which I almost use more than osteopathy, is acupuncture, where you stick needles around the area. This is a very good effect of reducing nerve pain. It inhibits nerve pain. There's a lot of evidence that it helps increase blood flow, and you use needles around the buttock area, around the back area, sometimes in the leg as well. And I use that in conjunction because it speeds up recovery. Very often I see a person with sciatica, and within a few sessions they're already feeling better. Not all cases, but a significant number of cases. You can help reduce those symptoms. The other type of sciatica I mentioned is when pain emanates from the buttocks and it goes down the leg. And you can use trigger point acupuncture around that area. and which means sticking needles in, getting a response, and then taking the needle out, and that's sometimes enough just to reduce the symptoms there and then. Very effective, and I use it a lot for these referral patterns that I mentioned earlier on in this short talk. So those are the three things I do: osteopathy, acupuncture, and trigger point treatment. Now, to talk about the more conventional treatments in terms of what happens if the sciatica doesn't go and you go to your GP, main mainstay of treatment is using medication. You use anti-inflammatories or the cocodamals, which are more opiate-based. And also there's another drug called amitriptyline, which is more for chronic pain. All can be effective, but there's a big but, it doesn't cure the problem. So if you're in a lot of pain, it's certainly worth taking, but for long-term relief, it's not that effective. And the problem with anti-inflammatories can upset the tummy quite a bit, and it's not suitable for asthmatics and those on anticoagulants. So you have to be quite wary of taking them. And the other problem with them is that they may only take the edge off the pain, but it's certainly worth a try if a person's in pain. And certainly I treat many people in conjunction with people on medication. And within a few sessions they come off or start reducing medication because it's not needed, as the pain reduces with the other treatment, the osteopathy and acupuncture that I do. If that doesn't work, if conservative treatment fails, which does happen, so you've tried everything, you've had medication, you've had osteopathy and you're still in pain, then I send people, that's the time I send people for a scan to see how much pressure is on the nerve. If it's a lot, then you can consider injections as the first alternative, because it's more intervention, but it can help people. Many studies have been done to see the comparison with epidural injections or facet joint injections around the sciatic nerve. But long term, there's no difference in both conservative treatment and steroidal injections for sciatica. But people often ask, well, what's the point in doing it? There is a but, and that is people are in terrible pain. So to give some relief, sometimes it can be considered, and it's not as bad as surgery, which brings me to surgical treatment. Excuse me. With surgery, mainly what's done if a disc is found is what's called a microdissectomy. So surgeon goes in and removes that part of the disc that's sitting on the nerve. These days it's done less and less because usually the treatments that I've highlighted are, over 90% effective. But if you're unlucky enough and the pain persists and the disc just keeps on irritating that nerve, very occasionally sciatica has to be considered, particularly if there are motor symptoms, which means there's weakness in the limb, that you can't lift your foot up, or you get other big signs of nerve dysfunction, that the leg is weaker. So with surgery, as I said, the actual disc is surgically removed. These days there are disc replacements which are controversial. Some people say they work, but it's not done overwhelmingly yet. And usually what happens is that the disc is removed and you get a bit of disc shrinkage around there, and that stops the pain. Again, very few need to be done, and it is an effective treatment for those that absolutely need it. So I hope that informs you, and that is the end of my short talk on sciatica. Thank you for listening. Any questions, just email me. Bye-bye.